Firework! 105.1 The Buzz, Daria Mitch and Ted. We welcome to the show cosmetic surgeon and friend, Dr. James Chan.
Hi.
So Dr. James Chan, I'm going to give away the idea so you can't use it.
You're stealing
Dr.
our
Chan was
idea?
like, it's not. Do you want me to say it, or is this something that you're seriously thinking of doing?
You can talk about it.
Okay,
I
so
don't think he's too serious.
I just want to tell people what happened in this room and what the kind of thing that I have to live with all the time. So Dr. Chan comes in, and we're just making conversation. And he's like, do you know what people should do around this time of year? Is a lot of people want those elaborately carved pumpkins where you look at it and you're like, oh, it's a work of art.
But who has the time?
Or you don't know how.
Right.
So it's interesting that there's not a service or lots of services where somebody will come to your house or you bring them a pumpkin or whatever, and they'll do the carving for you, and you can pay them an artist fee.
Right.
And maybe that happens, but if it does, none of us know where it is. So Mitch hears this and he's like, yeah. So Dr. Chan, you and I will get a bunch of carvers and we'll have them in a warehouse. And he's like, he just takes the idea,
This is gonna be
pretends
huge.
that it's his,
Ours.
and then starts making like forecasting all the money he's going to make from it. Dr. Chan's like, he's too polite to say anything.
I had the brilliant idea. We'll get medical students, surgeons that need to practice on pumpkins and whatnot.
It doesn't work. First of all, you will never do it. You will never do it. All
I'm
you'll
just the
do
big
is
idea
talk
guy. I'm not the implementator.
When it comes to actually doing it, you'll be at home and you'll be like, well, I could work on the pumpkin carving idea that I didn't have, or I could sit here with a cocktail and I could watch more shows.
Bingo.
That's right.
When they come up with a way for you to profit off that,
Then I'm in and I'm rich.
Then you're going to have your boat. Okay, so Dr. Chan, I have a question for you. One thing that I see ads for now that I never used to see ads for, so I don't know if it's a new thing or if it's just being publicized a lot now, is it's called a lot of different things. Sometimes it's called a mini facelift. Sometimes it's called a lifestyle lift.
Yeah.
Sometimes it's called a laser lift.
Yeah.
Yeah, or a quick lift. Basically, what it seems to be is like a little facelift that doesn't have as much scarring or as much downtime and is maybe cheaper. What is the story on those? First of all, what's the difference between what happens in that procedure and how is it different from a full-blown facelift?
Right. So mini lifts are good for people who are very young and just don't need a whole lot of lifting. The reason you hear so much about them is because they're heavily marketed by Lifestyle Lift and Quick Lift. And the problem with this procedure is that if you apply that mini lift to everyone, you're going to have a lot of unhappy patients because it just doesn't apply to everyone.
You have to fit within the perimeters that are good to have a quick lift to really benefit from a quick lift.
Correct. And it's just a very small segment of the population that will benefit from that. And that's why when you read these online reviews about that procedure, a lot of people are unhappy because they've taken one procedure and they've tried to apply it to everyone. So basically, there are three types of facelifts. There's a mini lift, there's a traditional facelift, and then there's something called a
super lift,
a deep plane facelift, right? Which is a lot more aggressive, and with that, there's inherently more risk.
You said deep plane? Okay.
Deep plane
Deep
facelift.
plane. Okay.
that needs a better marketing term.
Yeah, that's not so good.
Yeah, I would call it super facelift. Yeah. Extra super fancy candy facelift.
Because deep plane, I'm thinking like a woodworker's tool, like a planing thing. That's a little
that's
too much.
Yeah, I don't want to know that's what's happening.
Not on my forehead.
So tell us about the difference between the three. What happens in a mini lift?
So with the mini lift, you're barely lifting. I mean, it's really mostly skin that you're addressing. With the deep plane, as you've tried to describe, you're really going deep. There's a lot more surgery involved, bigger incisions, a lot more time. So it's a lot more aggressive. Now, the one that most people do that applies to the majority of patients is the traditional facelift. It's also known as a SMAS facelift, SMAS. And the SMAS stands for...
You've got some SMAS in your belly button, I think.
Don't talk about my belly button. Stop it. It's off limits.
And then when you dig it out, your finger smells like SMAS.
I know that smell. I don't care for it.
So, SMAS stands for submusculoaponeurotic system, and it describes that muscle layer that's right under the skin. And that's the layer that you really need to pull and tighten in a traditional
Not
face.
the surface skin.
Not just the surface skin.
Really?
You have
I had
to
no idea.
Support the underlying foundation. That's how you get a very natural looking facelift that actually lasts. If you just pull skin, like in a lot of these mini lifts, they don't last, and you end up with a lot of scarring.
And are the scars, when you pull back the skin for a man, are all the men scars in the same places? And all the women's scars in the same places? Or is that...
Yeah, so some surgeons will take the male facelift incision just a little more forward so you don't pull the beard all the way into the ear canal. But a lot of people just make the same incisions because they hide so well.
And with men, it's in front of the ear or it's behind the ear?
In front.
Right in front of the ear.
Right. For men and women, the incisions usually start in front of the ear and they actually go around the earlobe and to the back.
I read once in a crazy magazine that was in a doctor's office that there was a type of brow lift, and I'm not making this up. There was a brow lift where you took, I think it was wires or some sort of surgical string, okay? And you basically like strung it on a needle. You make, I guess, you tie it somewhere around the eyebrows, and then under the skin, you drew it, put it back, and then like pull on it.
Oh my gosh!
Do you know what I'm talking about?
Yeah.
That's insane.
Yeah. So for a while, there was something called a thread lift.
Yes.
They're basically barbed sutures that you thread through the skin, and exactly like you said, you pull behind the ear or over the head, and you try to tighten it. The problem, as you can imagine, is that
barbed wire
in your head.
When you do that, you're not cutting away any skin. So what do you do with all that excess skin? It just naturally relaxes and it doesn't work.
So they don't do those anymore?
No.
Okay.
No.
Good.
Jeez.
How old was that
but like,
magazine?
what about the point? It wasn't that long ago. I'm thinking about the people that were like, that's for me. That's a good
That's
idea.
what I want.
And they're like, why do I have wrinkles up on my top of my head now? And how come every
Owie.
time I push my forehead, it burns like a
Jeez.
a tiny knife?
That's right.
One thing that I want to ask you quickly about the smaller lifts, like the mini lifts and the basically the sounding too good to be true lifts. Are there some places that, because they're so small, because they require so little surgery, where it's maybe not necessarily a full-fledged board-certified plastic surgeon doing them?
Correct.
Now, how much danger is there in going to a... And they're, of course, charging less.
Right.
So
Right.
what's the danger there?
So I think that it's very important, if you're going to get a facelift, that you go to a specialist who can help customize the procedure for you, because everyone's face is different and you can't apply the same exact procedure to every single patient. You really need to customize it. And when you do go to some of these places that don't have board certified plastic surgeons or even surgeons, they may be non-surgeons doing this.
Non-surgeons?
Really, correct. If you're a doctor, you really can do pretty much any procedure. They don't limit you, and you can advertise it, but the problem is you may not be qualified.
I didn't study feet in medical school, but I really like them. So I'm gonna
Right.
I'm gonna go ahead and operate on your toes.
That's scary.
I don't really know what I'm doing. I'm more of an eye doctor, really.
Let's
but
learn together
Right.
as we
you
go.
teach me. Dr. James Chan is, of course,
Yikes.
fully board certified and an expert in the musculature of the face and the science of aging. Go in for a consultation and figure out what the best treatment is for you. It doesn't have to be surgical. There's a whole range of options to help you feel more youthful, look more awake, and just generally feel better about yourself and more confident. Check out his website at drjameschan.com, and we'll see you back here in a very little while. Have a great Halloween.
Thank you very much.